Hello, my name is Christopher Smith, and I'll be speaking about body mechanics and rheumatoid arthritis. Now, as we go along this presentation, if there are any questions, please don't hesitate to ask. The following slides presented in this presentation are taken directly from the poster board presentation bearing the same name, but due to visual constraints in having it on camera, they shall be presented in this video as PowerPoint slides. This presentation is directed at two groups of people: those with rheumatoid arthritis who are having difficulty doing day-to-day activities, and those who know RA patients who, like me in the past, haven't been as patient and understanding as we should. Upon conclusion of this presentation, the viewer will be able to understand the following ideas: what rheumatoid arthritis is, the basics of body mechanics in the effort to avoid injury, and finally, how those concepts differ specifically for those who suffer from rheumatoid arthritis. Now, in this instance, the healthcare professional, or PTA in this particular instance, is responsible for two things. Number one, actually treating the person who shows up who has RA. And the second is to educate that same individual towards the ultimate goal, which is independence for those who suffer from it. In addition, this presentation will cover the basics of body mechanics, as well as the basic description of what rheumatoid arthritis is for those who may know someone afflicted with the condition. My personal hope is that by the end of this presentation, people will see that those afflicted with RA in a whole new light and hopefully be more understanding of what they're going through. So, what is rheumatoid arthritis? Well, it's an autoimmune condition in which the body will essentially attack itself by way of the joints as well as various organs in the body. Essentially, the immune system is designed to destroy foreign bodies or foreign invaders who happen to get in. Only with this condition, those foreign bodies happen to be the body itself, such as various joints, knees, fingers, toes. Practically any joint in the body is susceptible to this condition. RA is also known as a body-wide disease, which means the damage isn't just limited to the joints specifically, unlike other types of arthritis such as osteoarthritis, which focuses entirely on the joints. This pain associated with RA specifically is especially prevalent in the morning after the body has been stationary for a good amount of time, but generally decreases as the day goes on and the body has been moving. The cause of the condition to this day is still unknown. However, those have noticed some factors more specifically which may influence. Factors such as genetics, abnormal autoimmune response, or hormonal and or viral infections are some. For me, personally, I married a woman who has this condition, and one of the most frustrating things I encountered was when she was constantly asking for help with minor things. Me, I didn't get it. I couldn't figure out why she was constantly asking for help. It was certainly something I was not used to. It wasn't until I realized later that she was asking for help because almost everything she did was painful. Doing simple things such as reaching for an item in a cabinet or trying to open a bottle for her was like someone stabbing her in the wrist. It was certainly a wake-up call for me personally. And this leads us to the next part, proper body mechanics. Well, what exactly is it? Proper body mechanics is used to do various things, such as conserve energy, reduce stress and strain to various muscles, joints, and ligaments in the body as well. The act itself is an attempt to maintain complete control and balance over the body, with the main goal of preventing injury. But then again, how is it done? Well, there are various items which contribute to proper body mechanics, but all are necessary in order to reduce the risk of injury. Items such as ensuring your stance is shoulder width apart in order to maintain a good base of support is one. Lifting with the legs, not with the back, which also applies to placing items down as well, not just picking them up. Another item is keeping the back straight and your shoulders back. What this does is it reduces strain on your spine. And finally, keeping the carried item close to your center of gravity. The center of gravity for most can be located either at the chest or at the hips. It is also important to mention that carrying an item with outstretched items is not recommended. Keep it close to your body. But how does proper body mechanics apply for a patient with RA though? First, RA patients are different in that their joints are extra sensitive. This requires those with the condition to take extra precautions with their body. For those who have the condition, the following suggestions apply. Number one, do not lift heavy loads unless you absolutely must. While watching body mechanics is very important, number two, you must also pay close attention to the joints, such as your knees, your hands, and your feet. Take care not to put extra weight or pressure on them. Number 3, don't be ashamed to ask for help, especially in a condition where almost every movement is painful. It's perfectly understandable why you would ask for it. Number 4, keep your joints moving. This ensures the release of synovial fluid, which lubricates the joints and lowers the amount of pain felt. Number 5, ensure your grip is released every 15 minutes or so when you feel fatigued. In addition, most importantly in my opinion, take breaks and rest. This is essential in order to prevent your condition from getting worse. If you perform a task and are still experiencing pain 2 hours after you're finished, cut back on everything else and get help with your other projects. But what about the joints? Well, when it comes to RA, it's best to realize the difference between your smaller, weaker joints and your larger, stronger ones. Your smaller, weaker joints, such as your fingers, your wrists, your ankles, and such, should be reserved for lifting those items that are light and can be easily manipulated with little effort. Your larger, stronger joints, on the other hand, such as your arms, your legs, your torso, knees, and such, must be reserved for those heavier items that require more effort to manipulate. In fact, for heavier objects more specifically, it's best to avoid utilizing the fingers and carry with an open palm instead. Be sure to watch the wrist, however, when you do this. And when manipulating objects with fingers, use tools such as a handle jar opener here to spread the force throughout the palm instead of focusing on the fingers. I have an example of a handle jar opener right here. As you can see, there are actual teeth right along the edge here. My wife loves to do this. My wife has rheumatoid arthritis, and this is one of her most favorite tools. Actually, it's funny because when I went to use this, she didn't realize that I had moved it. She freaked out a little bit because she loves this thing. She absolutely must have it. The cool thing about this is that the way it's utilized is that, of course, with most people, when they latch it on to a jar, they would use their wrist in order to turn it. The key with rheumatoid arthritis patients is they don't really have that strength in the wrist, so what they do is they get their whole body into it and they push against it, and it pops open the lid, at least in theory. Ask my wife about that. Now, as I stated before, the key with this is not to use the wrist, just push with the whole body instead, so that way it saves you a whole lot of time, a whole lot of hassle, and more importantly, a whole lot of pain. Which leads us to our next concept of good body mechanics, working smarter, not harder. This is a perfect example of what I was talking about just now. While a very simple concept, unfortunately in my own experience, the idea of working smarter and not harder is not really one that's practiced very much. In fact, it's very much overlooked. Like the handle jar opener, injury can be prevented by simply using various factors to your advantage. In that particular case earlier, it was using your body weight instead of your wrist strength, or lack thereof, for RA patients. Use both hands as much as you can is one of the first ideas. Sit in a chair for whatever task you can. Now this is something my wife loves to do when she's cleaning the bathtub because there isn't as much pressure on her knees and back. Ironically, I told her this last weekend and she realized that, hey, this is pretty good. So hopefully that helped her out a little bit. Eliminate any unnecessary tasks, such as using your dishwasher instead of manually washing the dishes. Use expandable items to clean out of reach areas. We specifically love the expandable Swiffer brush. We live by that thing. Next one is minimize travel distance, rather. A good example of this is to place your dirty dishes right next to the sink or the dishwasher so you don't have to carry them long distances. Slide or kick items instead of carrying them if you can. Now, don't pretend like you're a soccer player and you're going to kick it across the field. Just push it with your foot so you can spare your upper limbs. And please keep in mind also that this is assuming that if you are in fact an RA patient, that your condition hasn't become prominent in your lower extremities. If it has, I would not recommend kicking anything. Finally, when in doubt, get help. Don't be too proud to the point where you hurt yourself. It simply makes no sense at all when you have someone nearby who can do it for you to not ask for help. And the beauty of working smarter, not harder, it doesn't just apply to RA patients, but it applies to everybody. So this isn't just specifically for RA patients. It's whoever can get the idea in their head and be able to utilize it properly. So in conclusion, we have learned that RA is a condition where the body attacks its own joints and organs. We learned that proper body mechanics for RA patients is more stringent than those without the condition. And finally, proper body mechanics for RA patients can involve concepts such as favoring the larger, stronger joints over those that are smaller and weaker. Working smarter, not harder, of course. Getting help when is needed. And finally, last but not least, take frequent breaks and rest. And for those of you out there who know a person with RA, my hope is that this little bit of information has helped explain why things are so difficult for them. I know for myself, knowing that RA has helped me be more patient with my wife, and I like to think a little more helpful, has not only helped me take a huge step in the right direction as far as being a better person, but also being a better husband, but also helps her out a bit. I think for a lot of these folks, it's nice to know that people understand, which is essential. So, in order to see just how much you, the audience, have absorbed my presentation, I have 3 questions for you to answer based on the information given in this presentation. The first, rheumatoid arthritis affects what 2 parts of the body? It's either A, joints and organs, B, joints and spleen, C, skeleton and muscles, or D, all of the above. The answer is A. Question 2, true or false? For those with rheumatoid arthritis, it is wise to save the smaller, weaker joints for heavier items that require more effort to lift. The answer is false. Smaller, weaker items are meant to be utilized for lighter items, not larger items. This is important. And last but not least, question number 3. Which of the following was not one of the work smarter, not harder suggestions? Was it A, limit travel time by putting dishes next to the sink? B, use the dishwasher instead of washing the dishes by hand? C, sit while doing some chores to help with the back and knees? Or D, lift with the legs, not with the back? The answer is D. I hope all of you enjoyed this presentation, and before we go, I just want to open the floor for any questions. So if there are any questions, please feel free to ask. With that being said, if there are no questions, then for the purposes of academic integrity, I present the reference slide. Thank you very much.